Hello, welcome to the first episode of Clean Health. My name is Dr. Oby Coucou, a West African trained cardiologist, a fellow of the West African College of Physicians, and a member of the Endocrine and Metabolic Society of Nigeria. Today, we'll be talking about a very important topic known as diabetes. I'll give you an overview of what diabetes is, the types of diabetes, who is affected, and the risk factors for type 2 diabetes. Stay tuned with me as I come right back.
Diabetes is on the rise and trend. Millions of people dying every day. It's a silent killer. So much glucose in the blood lead to insulin, leading to stroke, heart attack, kidney failure. Diet, exercise, dose, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes. On the diet, exercise, dose, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes.
Welcome back. Now, what is diabetes? Diabetes is a chronic, debilitating, and costly disease. What do I mean debilitating? It affects the health adversely and is a serious disease. It is known as a silent killer. And what do I mean by a silent killer? People could have diabetes walking around normally for years without knowing, but the disease will be slowly destroying organs in the body. To a layman, diabetes means high blood sugar, isn't it? So when the sugar level is high in the blood, okay, it can be very dangerous because over time, it will be destroying organs in the body, from the brain to the blood vessels, to the kidneys, to the all the systems, the food, everywhere in the body, all the organs in the body. So diabetes is a serious disease. But the good news is that it's a preventable disease. Okay? All right? And now, so you would ask me, what are the types of diabetes? We have several types, but there are two major types, the type 1 and the type 2. The type 1 are commoner in children. Okay? There, they don't have a hormone, that hormone, insulin. They don't have it at all. While in type 2, it's commoner in adults, greater than 30 years. Okay? It's responsible for about 90% of cases, type 2. And there, they have that hormone, insulin. But that insulin they have cannot bind to the cells where it's going to act to carry the sugar from the blood to be used at the cells, within the cells of the body. Okay? So, because the cells are not sensitive, they resist insulin. Okay? So, insulin cannot bind. Hence, it cannot perform its function of carrying sugar to be used in the cells. As a result of that, they have high blood sugar in the body, but their cells are crying for lack of food. They don't have energy. And so they appear weak and they have other complications from it. Now, who are those that are at risk? Who are those that can have diabetes? A lot of people are affected, and it affects all ages. Okay? All right? Now, there is about 429 million people affected worldwide. Okay? Or adults are living with diabetes all over the world. And it's estimated that by 2045, 629 million people will be living with diabetes all over the world. In sub-Saharan Africa, where we are, we have about 16 million adults affected. And it's estimated that by 2045, about 41 million people will be living with diabetes in Africa. in Nigeria, there is a rising prevalence. It was about 5.7% as of 2015 from a study done, okay? But it's rising. In the past, there was nothing known as diabetes was not existing really in the past. But over time, there is a paradigm shift or an increased prevalence. And this can be attributed to the adoption of Western lifestyle. You find out that a lot of Africans have started living like the white men or the white people. They're adopting their lifestyle of eating, for instance, their diet. They eat more of canned food, processed food. Do you understand? And so they tend to be at risk, okay? Even with the advancement in technology, okay? The computer systems, people sitting down for hours, they are more predisposed to developing diabetes because of westernization, okay? So it's a problem and it's a cause for alarm. That's why people need to be aware. The society, the layman needs to be aware of what diabetes is and will look for measures to prevent and control it, okay? To avert its complications. Now, someone could ask, what are the risk factors? Who are those who are at risk of having diabetes? Okay? We have those that are modifiable risk factors and those that cannot be modified. What do I mean by that? Modifiable means if you adopt lifestyle changes, okay, will prevent the progression. Okay? But those that you cannot modify are those that you find naturally with existence and you cannot change them. For instance, age. As you grow older, you tend to develop diabetes. Greater than 45 years, you're at risk of diabetes. Okay? Sex. Males are more affected than females. Especially because of the male hormone. Okay? So males are more affected than females. Then even women who, after menopause, they are more affected because they have more of the male hormones than the female hormones. So they are more at risk. Also, black race, the race is important here. It cannot be modified. People who are Black Americans or African Americans are more at risk of type 2 diabetes. Family history. There is a place for genes or genetics. Okay? If you have a family history, maybe one member of your family has diabetes, you're at risk of having diabetes. You understand? So if you have brothers, sisters, or cousins, or a father or a mother who has diabetes, the tendency is that you will develop diabetes. Now, what are those modifiable factors? One of the most common or important one is obesity. What is obesity? Obesity means being what? Overweight, or when you're overweight, isn't it? When you're fat, overweight or fat, okay? Let me put it in a way you could understand. All right? So if someone is overweight and his body mass index, what we call BMI, body mass index, is greater than or equal to 25 kilograms per meter square, okay, that person is overweight. If your body mass index is greater than 30 kilograms per meter square, you are obese. Now, what do I mean by body mass index? If you measure your weight, okay, and then measure your height, and you divide your weight by your height square, some of you can determine it right away. You can try and calculate it. Measure your weight, measure your height, square your height, then divide your weight by your height square. If it's greater than 30, then you're obese. If it's greater than 25, then you are way overweight. Do you understand? So that is obesity. Some people have what we call pot belly syndrome, which I've talked about before, where they have excess deposition of fats in the tummy, and that fat is not good. That fat can block the receptors or the sites where that hormone should bind to function. When it blocks it, the hormone cannot perform its function, and then they develop diabetes. Okay? Another risk factor is what? Sedentary lifestyle. What do I mean by sedentary lifestyle? Lack of physical activity. You see, people, they don't do physical activity. Okay? You're expected to exercise at least 3 times in a week. But a lot of people, because of a fast life, we have a fast life, Everybody, you wake up first in the morning, you rush to work, you don't have time for exercise, you come back late from work, all right? So we tend to live without exercise or physical activity, all right? And so people are more predisposed to developing type 2 diabetes because of lack of exercise. Then also sitting for long periods of time is part of lack of physical activity. That's what is known as sitting syndrome. When you sit more than 4 hours a day, you're at risk of type 2 diabetes, okay? And how do I translate that to you? A lot of times, if we watch our lifestyle, we focus on watching TV. So people can watch TV for more than 4 hours. In fact, almost can stay from morning. Some people stay morning to evening watching TV, all right? Some people are on their computer systems, all right? Your laptops, you're doing one research or the other, or you're on, searching the internet. There's social media. People are on their phone, so they could sit for hours, without just on their phone, social media. And then they're at risk of type 2 diabetes. Studies have shown that people who sit for more than 4 hours are predisposed to type 2 diabetes and cardiovascular mortality. They can die suddenly, okay? They can have heart disease and complications, okay? So it's important that we stand more often than sit. Even if you're sitting, you're busy, just between your sitting time, you stand up, walk around, then go back, sit. Stand up, walk around, do some, or stretch out. Do you stretch out your hands? So do some activity. There are other risk factors, such as smoking and alcohol. When you smoke or you take alcohol, it's not good for the body. It gives you at risk of type 2 diabetes. People who also have hypertension, okay, at risk of type 2 diabetes. So if you have hypertension, high blood pressure, okay, greater than 140/90 millimeter, you check the upper blood pressure and the lower blood pressure. The upper one is above 140, the lower one is above 90. You're at risk of type 2 diabetes. Even there is a recent redefinition of the threshold for hypertension at 130/80 millimeter mercury. So if you notice that, please do proper health checkup. Try and see your doctor. Okay, check your blood pressures. You can't just stay moving around without checking your health, doing regular checks. Okay, so that we prevent diabetes. Okay. Also, the type of diet we eat is important. Okay. For instance, salt in diet. People that take a whole lot of salt at risk of diabetes. All right. So what do I mean by salt? Added salt. Sometimes when you cook, you could cook and then bring your food and present to your husband or your children, and then there's a table salt in a container. So you see some people adding salt. That added salt is not good at all. All right. Don't do it. It's not good at all. It can lead to diabetes. All right. Now, some people say, my doctor said I should not eat salt. And so they stop taking salt. They say, I don't eat salt. But you can imagine, they are going to take Maggi cubes. And sometimes they put up to 10 cubes of Maggi in their cooking. Now, 1 cube of Maggi, they don't remember or they do not know, contains 5.8 to 5.8 to 6.5 grams of sodium. Right? Sodium is salt. Now, your body requires only 4 to 6 grams. But you are taking in 1 Maggi cube, 5.8. And then you see people putting 10 cubes of Maggi in their cooking. Multiply it by 10. That's about 58 to 65 grams of sodium. And you require only 4 to 6 grams of sodium. That is a whole lot, please. Please stop it. It's not good for your health. Excessive salt, okay? It's not good in diet. We talk about fatty diets. People that eat a lot of cholesterol in diet. Saturated fats, okay? Like for instance, in the Hausa land, there's what is known as mein shanu. Mein shanu is a very nice meal. It's very tasty and very nice. It's like, how do I describe it? It's oily, sort of. It's very nice, it's oily, sort of. So, a lot of Northerners, they take mein shanu, all right? I think they get it from cow or so, right? Now, this mein shanu is not good because it has 100% cholesterol. And when you have high cholesterol level, you're at risk of having diabetes. People who take, when they go to market, instead of buying the good oil, they go for the cheaper ones, okay? So they go and buy that red oil that sleeps because it's cheaper. It sleeps. That sleeping oil, you put it, is hard, it's congealed. You shake it, it's not shaking. Till you put it on fire, that oil is very dangerous for health. It can give you type 2 diabetes. Okay? Thank you for watching this video. You can click on the like button, comments, and share the videos to people so they could be more aware. Thank you so much. See you in the next episode.